All right. So again, welcome to our amazing speakers for two sides of line, exploring gaps and opportunities in ethnocultural crisis response. Um, Today, we are thrilled to welcome incredible team presenting finding from Distress Center, Calgary Knowledge Hub research on crisis response for ethnoculturally diverse communities. The session will highlight insights from both community members and stakeholders and explore culturally responsive approaches to supporting individuals in crisis. We are joined by Dr. Monica Sesma Vascos, Assistant Professor and Director of the DCC Knowledge Hub, leading research on suicide crisis response and affirming practices for LGBTQIA2S+ and ethnoculturally diverse communities, with over 20 years of experience in the mental health field. Also, Dr. Tara Collins, adjunct professor and research project coordinator, as well as seasonal instructor with more than 20 years of practice experience. As you can see, we have a large and impressive group of speakers today. While I'm not able to introduce everyone individually, I strongly encourage you to go to the webinar page and read their amazing bios. Without further ado, I will turn it over to our speakers. Uh, Thank you so much for coming, and I'm so excited to see your finding and learn more. So I will stop sharing and feel free to share your screens. Thank you.
Thank you very much, and the Newcomer Knowledge Hub for inviting our team, the Distress Center Knowledge Hub. So we appreciate that. Thank you very much. So right now we are going to show our PowerPoint, and we will start. But thank you so much for this invitation. And if you can go to the next slide. So my name is Monica Sesma. I am the director of the Distress Center Knowledge Hub. And as I was introduced, I am an assistant professor in the Faculty of Social Work. And our team is composed by students, academics from the Faculty of Social Work, University of Calgary. The University of Calgary, as you know, is located in the heart of southern Alberta. Both acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, comprised by Siksika, Piikani, and Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. We know that the city of Calgary is also home to the Métis Nation within Alberta, including Nose Hill Métis District 5 and Elbow Métis District 6. I am originally from Mexico, Mexico City, and there is not one day that passes that I can't breathe this clean air from the mountains, and thinking how grateful I am for living, working, having friends, having laughter, and having fun and loving in this land. So thank you very much. As a settler in Calgary, I feel very grateful every day. Thank you, Ian. Can you go to the next slide? So as we present our pieces, we will introduce ourselves. As I said, my name is Monica Sesman. Thank you very much for being here. And with me, it is my team, Tara, Mariam, Aklam, Nathaniel, Jerry Lee, Anna, Ind, Sandra, Elizabeth. They will share more about themselves when they speak, but I feel very grateful to have this strong, talented, and fantastic team, and we are doing research together and sharing the wisdom that we have collected with you all together. And can you go to the next slide? And here are some learning objectives, and I will not read them, but what we would like to get out of today's presentation is that you all learn more about how we are doing research with community, for the community, in the hopes that our knowledge and the knowledge that we are creating can help you as frontline practitioners and organizations to improve services. So in order to improve the life of Calgarians and inspiring other people in Alberta or other part of the world, we really want to focus on how the field of crisis response has not been very aware or sensitive to the cultural differences, ethnocultural differences, and our research is aiming to try to improve, enhance services by highlighting key aspects of providing ethnocultural supports for suicide or domestic violence and crisis issues. Would you mind going to the next slide? So who we are, I think you can find more information about us in our website, but what we mostly want in the Distress Center Knowledge Hub, as I was saying, is doing research with organizations in the community. We want to approach organizations and ask them what do you need to know and how we can put our research skills and competences to your service. So this is how the collaboration with the Distress Center Calgary emerged. One of the things they wanted to do is to improve the services they are offering for ethnoculturally diverse callers. So we will be unpacking more about this research, but the main goal of the Distress Center, and that is why they partner with us, is they thought that the approach they were having about having the same training or the same kind of approach with any caller was not meaningful and impactful with some communities. So the main research question for us was, how can we improve services? How can we train frontline practitioners to improve these calls when it was someone like immigrants, refugees, racialized groups, or anyone from an ethnoculturally diverse group when they call for suicide or other type of crisis. Thank you, Ian. Can you go to the next?
Hi, everyone. My name's Tara Collins. I'm the project coordinator as well as a sessional instructor. And so I apologize. There's a dog barking in the back, which she wasn't earlier. So hopefully she stops. So not only, I want to expand in terms of not only was it the Distress Center that was saying, you know, there is a gap in services, what we notice is that it is also Canada-wide. And so we have had the privilege of being able to talk to diverse callers as well as ethnoculture or crisis responders and stakeholders across Canada who work with ethnoculturally diverse individuals. We've also had what's called a World Cafe. So we brought together community members, we brought together researchers, and we brought together individuals that work within the community, and they all brought up different kind of concerns and different recommendations in terms of how to better support ethnoculturally diverse individuals experiencing crisis. So next slide, please. So some of the themes that came specifically from service providers that we will go into more are language barriers, limited cultural understanding, unfamiliarity with Western mental health language and perpetuated stigma, fear of police involvement, limited specialized training, and preference for community-based help. Next slide, please.
Hi everyone, my name is Anna and I'm one of the BSW students working with the team right now. So for the first theme of language barriers, we have a following quote to represent the findings of the team. So the quote is, if you had trouble communicating with this person, or if they had trouble understanding you, or if they had a strong accent, that could be something that you would speak about during the call. Like, I found this really hard because I could tell we were not understanding each other. So I wonder if they were able to get the full service because we were having trouble in that regard, and it was a little bit hard for me to understand them. So for us, a quote like this highlights the discussion around language barriers that came from service providers. And as they were speaking on it, we noticed these were twofold. When responders spoke with callers who they felt were in the process of learning English, responders feared callers may not fully understand the responder, or the responder had trouble understanding the caller. So challenges like this, especially when it comes to understanding the client, creates a significant barrier to access. And callers will not receive the full impact and benefits of the service if the responder cannot fully understand them, right? Or vice versa, because of this piece of the language barrier. So this lack of understanding, we notice that this could discourage callers from contacting the service in the future, and may lead to self-blame for the responder's lack of understanding, further marginalizing ethnoculturally diverse callers. And when it comes to our recommendations for this, we consider it will be important to have access to translators. Currently, some crisis lines have translator services, but it can still take up to 30 minutes to connect with a translator, which is definitely not sufficient in times of crisis. And we know that mental health language sometimes can also be inaccessible, or maybe too complicated to understand in those instances, with some words not having a direct translation to some languages, or even being too taboo for callers. So for example, for those who are familiar with the CIS training, questions like, are you feeling suicidal, may not be effective for every community member, as this can lead to them shutting down. And we will touch on this again later in the presentation. Next slide, please. And for the theme of fear of police involvement, we also have a quote to reflect on. The quote is, also, if someone's talking about a poor experience that they had with the police, and they say something like, it is because of who I am or because of my people, I had a difficult experience with police. That can be a hint sometimes. So we know that Western models of crisis response can often escalate to police, and that's something that's standardized to some point. So responders also recognize that ethnoculturally diverse callers may fear police due to their previous experiences of racism, or their fear that police presence may put them in physical harm. In systemic racism, as we know, so systemic racism can be embedded in those institutions. And for ethnocultural callers who are asylum seekers, or even applying to permanent residence, sometimes that fear of police involvement also revolves around that fear that this could affect their status, or maybe prevent them from receiving a refugee status eventually, or receiving their PR. And that fear can cause additional distress for the caller who was already in a crisis. So it is important that we know the impact of police involvement, so we can truly maybe take a pause, weigh the risk when we have to make that hard decision of whether or not we're going to involve them. And we will recommend decision makers review policies at their agency, so we can ensure that police involvement only occurs when it is a life or death situation, and we don't do it when it's not really needed. We need to continue to work towards finding other culturally relevant alternatives that could be suitable and also safe for an ethnoculturally diverse scholars. Next slide, please.
Hi everyone, my name is In. I'm a BSW student working with the team. So you see the code on the screen, it said I would definitely say more cultural training is needed. That's centered around the fact that everybody comes from a different cultural background. I think maybe going in a bit more in depth as to differences between an individualistic versus a collectivist society. Responders said they received very little specialized training. Culturally, responsiveness was often limited to a few slides in broader EDIA training, which only touch on the basics. Because of this, many responders felt unprepared to support ethnocultural callers. They emphasize that training needs to reflect that cultures are diverse with different practices, beliefs, and values. It cannot take a one-size-fits-all approach. Responders expressed not always understanding the context of a crisis line due to a lack of cultural understanding and lack of training. As a result, ethnocultural callers may feel the need to over-explain the situation or spend time educating the responder instead of focusing on getting support. Responders also highlighted the need to address differences between individualistic and collectivist approaches to crisis, and current crisis models tend to focus on the individual, which may not work well for collectivist communities. A more collectivist approach would consider the role of family, community, faith, and community leaders. Service providers are asking for training that is in-depth and specialized so they feel more equipped to work with ethnocultural callers. And have another quote here that said, I met someone who runs a national call line. It's a faith-based call line for Muslims. And that's exactly why they said they created it. Because people don't trust that the person on the other line will have the same values as them. But it's a faith-based call line, then the person will. So the service provider similarly noted that some community members prefer community-based supports for this reason, as callers would feel safer and more understood when the person they speak with shares their cultural background, values, and beliefs. And at the same time, many ethnocultural communities are close-knit, especially communities who are diasporic. This can create concerns about stigma when discussing taboo topics or raise concerns about confidentiality of the conversation. Together, these insights point to the need for both community-based and general crisis lines that are accessible to ethnocultural callers.
Hello, everyone. My name is Jerry Lee. I have been a practicum student with the Distress Center Knowledge Hub research team, and I am finalizing my Master's of Social Work program. So we're going to jump over to themes from ethnocultural callers. So in addition to speaking with service providers, we also interviewed ethnocultural individuals who had either contacted a crisis service line or also those who have not. From the caller interviews, several major themes emerged. These included a lack of cultural awareness from responders, gaps in aftercare and referrals, experiences with very generic or scripted responses, a strong preference for culturally matched support, and in some cases, callers were feeling discouraged from seeking help again after these negative experiences. You might notice some overlapping themes between the service providers and the callers, but as we dive into each theme, the needs for the callers will be noticeably different. What is really important here is that many callers were not saying the crisis line workers were bad or uncaring, but instead they often felt that the system itself was not designed with their cultural realities in mind. Next slide, please. One of the most common themes was a lack of cultural awareness. Many callers felt that they had to spend a large portion of the call explaining their culture, family, expectation, religion, or community pressures before they could even begin to talk about their crisis. For example, some of the callers talked about strict parenting, family honor, racism, or intergenerational conflict, and they felt that the responder did not fully understand how serious these issues were in their cultural context. Some callers also mentioned experiences like hate crimes or racism, and they felt the responders were not prepared to respond to those situations from a culturally informed perspective. So the issue was not just language, it was also cultural context. Callers would like responders to understand that culture shapes how people experience crisis, family conflict, mental health, and help seeking. Next slide, please. Another major theme was gaps in aftercare. Many callers said that after the crisis called, they were not given any referrals to culturally relevant services. Some were told to even search online or Google the resources themselves. So this is a significant issue because someone who is in crisis might not have the emotional capacity to search for services or navigate systems or determine which organizations are culturally safe for them. Some callers specifically said there were no resources offered that matched their language, religion, culture, or immigration experience. This shows that crisis support cannot end with the phone call, but rather culturally appropriate referrals and safety planning are extremely important. Next slide, and I'll pass it over to Sandra. Thank you.
Thanks, Julie. My name's Sandra Shive, and I'm a fourth-year BSW student working with the DCC Knowledge Hub. Another theme we heard repeatedly was that some callers felt the responses were very scripted or robotic. They felt like responders were following a checklist rather than having a genuine human conversation. Some callers described the interactions as feeling like they were talking to a dispatcher instead of someone who understood their emotional pain. This doesn't mean responders were doing something wrong. Crisis lines often require structured risk assessments and protocols, but from the caller's perspective, it sometimes felt impersonal and disconnected. This is important because in many cultures, relationship, trust, and emotional connection are very important to establish before someone opens up about personal struggles. Next slide, please. Many callers also expressed a preference for culturally matched support. This doesn't necessarily mean the worker has to be from the exact same culture, but callers wanted someone who understands their cultural values, religion, family structure, or community expectations. Some callers said if there was a culturally specific crisis line or culturally informed worker, they would choose that service instead. This highlights the importance of representation, cultural competency training, and partnerships with ethnocultural community organizations and faith-based supports. Next slide. A concerning finding from this research was that some callers reported being discouraged from seeking help again after a negative experience. Some callers said they felt misunderstood, judged, or dismissed. And after that experience, they were less likely to call again, even if they were still in crisis. This is very important because crisis lines are often the first point of contact for someone in distress. If that first experience is negative, it may prevent future help seeking, which can increase risk and isolation. And next slide, and I'll hand it over to Nathaniel.
Thank you, Sandra. So we have looked at perspectives from both the service providers and also from the callers, and definitely there is a lot of overlap. We see in these similarities that both groups recognize that there's limited cultural understanding. So they both see that there are gaps and that we have to have much more cultural competence. There's this mutual struggle with accents and language barriers. And then both of them see stigma as a key deterrent that prevents people from help seeking. And then both callers and providers also spoke about how many ethnocultural communities prefer community-based help. They prefer support systems such as their family, their elders, their religious leaders or community organizations instead of much more formal mental health systems. But this is important because what it shows is that both groups see the same problems, which provides a great foundation actually for solving the issues. Next slide. However, there are some differences in how they perceive things. So the differences mostly focus on the perspective. While callers stress personal harm and emotion, providers usually or seem to stress systemic issues. So the callers tended to focus on the more emotional impact of personal experiences, how the call made them feel, whether they felt understood, whether they felt shame or rejected, whether they felt supported. On the other hand, service providers would blame the institutional gaps, would see the logistical barriers, and would actually be able to hone down on the fact that they need much more awareness training. So essentially what we see here is that callers would often blame the individual interaction, while providers would point to system and institutional constraints. Again, both groups recognize and see the barriers, but callers experience the emotional impact differently and directly, while providers are often navigating how to solve the solutions, how to proffer solutions within the constraints of the organizations. And so the focus is that understanding both perspectives, if we want to change things, is important because it allows us to improve the crisis response, not only from the college section side, but also from the service provider side.
Okay, so suicide looks very different across different cultures, and we also want to just make sure that we're emphasizing this isn't necessarily a one-size approach, but we see a big difference between individualistic cultures and collectivist cultures, and ethnocultural communities more so align with those collectivist culture pieces. So as you can kind of see on the screen, we have that direct questioning can be an infective. And so when we're mentioning or we're talking about direct questioning, that's just explicitly asking your client or whoever you're talking to about suicide, if they're suicidal, if they're having any suicidal ideation, thoughts, or concerns. And this might not translate directly one through languages. And so for a lot of different languages, suicide actually isn't a word. And if it is a word, there's a lot of stigma associated with that word. And so that might cause that person to just completely shut down. There's a lot of religious implications around suicide in general. And if it's viewed as a sin, that also might cause somebody to shut down or not disclose. And so suicide is highly taboo in a lot of communities still today, and it can be connected to religious beliefs, shame, dishonor, family reputation. And in some communities, even just simply saying the word suicide is not acceptable. And some people have gone their whole lives without saying the word suicide in their families and circles. And instead of hearing that word suicide with a lot of ethnocultural communities, it's more of like circular reasoning. And so you might hear them um, say something that might point to the fact that they're feeling suicidal or have that ideation without explicitly saying it. So you might hear things like, I'm tired of life. I'm tired of feeling like a burden. I'm tired of I want to disappear. I want to go somewhere far away. I can't wait to meet God, or saying that God should take them. And so these statements indicate suicide risk or some level of that, but they're expressed very differently from how our most used suicide and risk assessment screening tools actually indicate on our little checklists. So there's also a lot of fears connected to systems, and some also fear that if they disclose suicidal thoughts, that police might be involved in talking about that really high level of police mistrust in a lot of these communities that would deter somebody away from help seeking. Another thing is that they might be hospitalized, or it could affect their immigration status. If you have somebody you're working with who has precarious immigration status, might impact their residency or their family. And a lot of these concerns we know as professionals aren't true, and that we would help them support them in getting the right resources. But a lot of these communities haven't actually been reached by crisis response systems to be told otherwise. And so a lot of our existing crisis informal systems aren't reaching these communities in general to really build that knowledge and capacity. Another piece is that they might avoid directly answering suicide questions because they might think that it might be disclosed to community, maybe their family. And again, that comes from that lack of knowledge and that lack of outreach from a lot of our organizations. So what this is telling us is that crisis responders should also be listening to, so one, to direct statements, but also those indirect statements and able to pick up on those things. Can you go to the next slide, please? So what we would suggest to do is shift from, are you thinking of suicide, to more indirect questions to align with that person's worldview. So asking questions such as, are things feeling so heavy that you're losing hope? Are you feeling disconnected from your family, community, or creator? Has the pain become so much that you're thinking about leaving this world? And so in simply doing that, you're actually aligning a lot more with that person's worldview and knowledge systems. And that kind of creates that space for them to feel more comfortable to open up and disclose those suicidal thoughts without even using the word suicide. And working with the distress center and just kind of in my work in crisis response in general, I know that a lot of people from ethnocultural communities will pick up the phone, and to even get to the point where they're calling is huge, but then they'll hear on the other line those 3 assessment questions, right? That it's mandatory for a lot of us to do of, do you have any thoughts of suicide? Do you have a plan? And do you have the means to carry it out. And as soon as they hear that, they hang up the phone. So that's why we're trying to really push to reframe those questions. So these types of questions will help somebody feel more safer and culturally appropriate, but also still allow us to assess suicide risk. So we want to kind of open up the floor at this point and just kind of talk about what suicide and crisis looks like in your cultures. So in addition to just talking right now about that indirect versus direct disclosures, crisis is experienced very differently across cultures. So a lot of people might experience it somatically, and they might express that through somatic expressions of, you might have somebody saying, my head hurts a lot ever since I came to Canada, or my heart hurts a lot, or my body feels really heavy. And so there could be those physical symptoms, but they can be also very interlinked with that mental health piece. And so here are some more on the screen, such as silence, withdrawal, shaking or physical distress, anger or irritability, over talking or pressured speech, religious or spiritual language, somatic complaints like headaches, stomach pain, heavy heart. And so what are some things that and you can feel free at this point to raise your hand or unmute yourself or put it in the chat, of what does crisis look like in your communities and your organizations that you work for? Do you feel as though some of these things might resonate with you and what you're experiencing or what you might see in your clients from different ethnocultural communities? Or just in general, what has your experience been like with crisis? And has this presentation resonated with you? Is there anything you'd like to share or add? And these can be some guiding questions too, but it's very open and flexible to whoever wants to share. But the guiding questions would be, how does your community label or describe crisis? Who's expected to respond when someone is in crisis? And just also acknowledging that a lot of people go to informal leaders and supports. And then who's silenced, minimized, or discouraged from speaking up? So if anybody wants to share. Or put in the chat. Okay. Please, not everybody all at once. Just joking.
I can share if you want, like, some encouragement.
Yes. Yes, please.
So crisis in my culture is like tremendous events like disaster, war, or sudden loss of one of the family or friends, family members or friends. So that's crisis. But the other real crisis will not consider as crisis as long as it's not like a huge or disaster or impact all the family member.
Yeah, and that's a huge thing that we see across so many ethnocultural communities is in Canada, it's almost limited to an individual crisis, but we don't acknowledge that a lot of ethnocultural communities come from different countries. And in those countries, like you said, there's wars, there's conflict, there's oppression, and very extreme and just like torturous almost. And so crisis systems here and responders aren't really trained to handle that or respond to that adequately. If you're saying, hey, I'm physically safe here, but my family might not be safe chronically back home, right? So that's another big thing. And thank you for sharing. And there's also a lot of ethnocultural communities are instilled with this sense of gratefulness of, we're grateful and lucky to be in Canada. And so why are we going to complain if people back home have it worse? And so there's almost that survivor's guilt that would prevent somebody from help seeking too. So it's very important. Thank you for sharing that. And it varies from person to person, even if they're from the same community. Yeah, a lot of people might feel comfortable sharing these concerns with crisis systems and actually accessing formal crisis systems. And some people might not be, might look different just based off of how they experience crisis or just their experiences of being in Canada as somebody who identifies as coming from an ethnoculturally diverse community. So yeah, again, and we just want to emphasize too, this isn't a one size fits all approach. This is just kind of introducing and starting discourse around how can we better crisis responses in Canada to better serve everyone and not just a specific group of people. Fanny says, sometimes I keep it in the family. They don't want anybody outside the family to know. Yeah, that's another really big one. Some people in communities internalize crisis rather than reaching out. Yeah, a lot of people feel like it's their own personal battle, and to reach out means they're almost admitting to defeat or failure. So very great points. Have people like, do you agree with that kind of different expression of crisis, and that a lot of communities or a lot of people don't directly disclose it, but you might hear it through, again, like maybe a heavy heart, for example, or I'm ready to meet God and those kinds of things? Does that resonate with people in this group? Yeah. I know since I started doing this research, and this has been shared by participants that we interview, is I've paid a lot of attention to it in my personal life. And I can really relate to what you were saying earlier of kind of the experience, like our versions of crisis are a lot more than just the individual crisis. It's rooted in like collective experiences and collective experiences in our home countries. And so I've picked up on a lot more of these expressions of crisis that I wouldn't have ever heard before I started doing this research. And now I'm like, oh, that's like somebody indicating that they actually need help, or there's kind of something bigger going on here. And so I encourage you to do the same too. People need to feel safe or trust before talking about the real issues. Yeah. And that's why with a lot of ethnocultural communities, they don't even feel safe in taking that first step of calling the agency. And if they do and they have a negative experience, and something to have noticed in working in the nonprofits in Calgary is, if you have a good rapport with the community, if they're reaching out. So if you're not accessing anybody from a certain community, because communities have built their own internal frameworks and systems to support each other. And so if one person has a bad experience, they might actually go back and say, oh, I didn't really like this agency, or they did 1, 2, 3. Or for example, with the distress center, it's in their mandate to connect with police if it's a high risk assessment. And if that happens one time, people will kind of share with their communities, and then they might feel fearful to reach out or not feel safe to reach out. And so that's why outreach and like knowledge mobilization and actually going into the communities and explaining why we do the things the way that we do is very important too. Does anybody from our team have anything that they want to share in regards to this?
Yeah, maybe about the second question, when we talk about who is expected to respond when someone is in crisis. In recent iterations of this lesson, many people have suggested, oh, close family members, or the friends of or extended family members, or maybe fire service or the police. But I think that an answer that came up which I really liked one time was all of us. So every single person is expected to respond at any point in time. Anyone can come to us with a crisis. Like Aklam was saying, we have to know how to identify when someone is in crisis and respond appropriately. So we shouldn't just think of crisis responders as other people, rather than us, right? So we could be a crisis responder to someone else who is in crisis. And that's something that I wanted to bring up as well.
Yeah. Thank you, Nathaniel. And if anybody had seen us advertising, we had actually done this in a 3-hour training twice previously, once online and once in person. And it was very intentional that when we were doing the flyers, that it said, if you're a teacher, community member, and that it's open to everyone, because it was just more so crisis is happening to everybody, and acknowledging in ethnocultural communities, you are not only here, you might be here as like a caseworker, settlement worker, whoever, but you're also a father, a mother, a sister, a friend, a colleague. And these are the people ethnocultural communities are reaching out to. So we were very specific to not just say this training is open to only social workers, for example, but open to everybody, because a lot of people are in crisis and not sharing. And if they are sharing, it's to people in our personal lives, right? Like in my personal roles and not necessarily my professional roles. And so thank you, Nathaniel. It's very important. Somebody asked Jane, is it also an option to encourage them to be more explicit in articulating their need? I think that, and anybody from the team can kind of jump in, but I think that would depend on your relationship with that person. If maybe it was somebody in a personal relationship and you were able to kind of share with them that how Canadian systems operate is more direct and that they would need you to specifically disclose that you're experiencing a crisis or having suicidal ideation. But sorry, I forgot where I was going with this. Is it an option to encourage them to be more explicit in articulating their need? But I think that this is why we're starting to have those trainings is do they have to be explicit? Like, or can we build the system to actually address all of these different worldviews? Because we don't know what the right way is, right? We don't know if direct questioning and being explicit is better than being implicit and maybe kind of going around. But if you as of now, with the way that current systems are set up, is you would need to be more direct to get the help that you need. And so I think that kind of comes back to your personal relationship with the person. As a social worker and in my practice in counseling and shelter work, I've kind of been able to pick up more on that. And then through guiding and like these questions of, I think if you can go back to like 2 slides. To the question, wait, sorry, my window is so small. I don't know why I can't see the screen. Okay, yeah, so this is kind of how you can guide somebody into being more explicit is asking those questions of are things feeling so heavy that you're losing hope? And that naturally will guide itself into a conversation, hopefully about suicide and being able to name it. So the point is to put less of the onus on them and be more receptive. Yes, literally exactly that. But through this kind of questioning, you can get to a point in building rapport and relationship with this person where then you can say and explain suicide, like, and directly name and express like the stigma around it, and then do a lot of teaching and mentoring in that regard. But to get to that point, I would say to match their wording. I think that's really huge too, is to meet that client where they're at, match the wording that they're using, build that rapport in the moment, and then you can get to a point of like mentorship around suicide and crisis, if that makes sense. I think I went quite around there, but.
And another thing I'll add is if you don't feel well equipped to help at any point and you want to refer them to a service, I think we spoke about warm referrals in other training sessions as well, is to hold their hand and work with them to the service and make sure that they get the right to appropriate service. Right. So you don't just say, oh, just call 211 and leave them there. You work with them and make sure they get the appropriate service.
Does anybody maybe have any feedback for this research? Does anybody think that there's like a gap that maybe we've missed or a specific theme or topic that you think that we should kind of look more into that maybe we didn't address today? Or just any feedback for us in general of the work that we're doing? How this presentation was for you?
We are also looking to interview more individuals who are ethnoculturally diverse. And so that certainly can be another way to help us figure out how to better support the population as well. And so, yeah, it's right there in terms of the research. So we'd love to hear from anyone. And you don't have to have called a crisis line. So we're actually looking to speak to ethnoculturally diverse individuals who either have called or have not had called, but there was a crisis, but there was a barrier to them calling. So.
Thank you so much, everyone, for sharing this eye-opening information. Actually, I have a couple of questions, but I will ask like one and leave it for the others. Is there any recommendations you came up for the service providers, stakeholders, funders after this study, research? Sorry.
So in our training that we do, we go a lot into the strategy and the practical strategies as kind of a helper in the community. One of those things would have been warm versus cold referrals and seeing the impact of actually guiding somebody through a system that they might not understand. And so a lot of the times in our work, we're very overworked, high caseloads, underpaid. And so a common practice is to say, hey, can you reach out, for example, to Center for Newcomers? Here's the phone number. And then assuming that person reaches out, something that would add a little bit more work on our end, but would create a more effective intervention would be to do a warm referral where you might call Center for Newcomers, for example, with that client. We also do and then follow up too, like follow up and say, because a lot of people won't come back saying, hey, this person didn't reach me. We also hold a lot of power as professionals in the field of if I called Center for Newcomers versus a client calling Center for Newcomers, that's a very different experience. And so leveraging that in our interventions, that's one piece. I think another thing too that we've talked about a lot is just resources, and there's a lot of resources in the community, a lot of community organizations that might not be on, for example, the 211 database. And so being knowledgeable and keeping up to date on what resources and programs are still even available, because I know a lot of times we refer clients to a program, but their funding got cut. So that would be one piece. And the other piece to this is we do an activity where we actually build our own crisis cards, where we identify key needs like food, housing, mental health supports. And we encourage you to access these resources that you're sending people to as a client to see what that experience is like when you're telling somebody to go call. In terms of organizational change and recommendations, I think a big piece that we talk about a lot is the needs assessments and the risk assessments and suicide assessments that are very much standardized across Canada and are the most commonly used and recommended. And all of these assessments include direct questioning and are not very culturally responsive. And so I think that's another piece, is looking at how can we alter or create something that has these communities in mind. Another piece is recognizing that assist is the most commonly suicide intervention that probably majority of us are trained in here. And it's great, very effective, but it was, I think our team can speak a little bit more to this too, but it was, when it was tested and created, it was on a sample population, I think, Monica, correct me if I'm wrong, of white women in the US. And so that was who assist was kind of created and then tested on. Monica, you can add anything if I'm wrong here. But yeah, so we're just kind of looking at the assist training and how can we better these suicide trainings to become more culturally responsive. And then if Monica, you want to speak to kind of more the systems level findings.
Thank you so much, Ahlam. Wonderful. Thank you.
Yeah, no, I can talk about that. Oh, sorry, but I interrupted you. The host. Yeah, you wanted to say something.
No, I'm not. Just thank you, Ahlam, and for all sharing. Thank you. Yes.
Yeah.
Dr. Monica.
And sorry, I forgot your name and
Rafi.
Rafi. Thank you, Rafi. So yes, I think that was an eye-opener for us, and we all have been trained in the Roberts model is the most common approach for crisis response that is highly focused on risk assessment and safety planning. And I think in the Canadian context, a group of Canadian scholars was very keen to revisit that model and create their own approach to crisis response in Canada. So the ASSIST model was created, tested with Canadians. But the thing is that for the Roberts model that is being used worldwide and in many countries like Mexico, we use the Roberts model. So we were curious about like, how is this supposed to be so effective? And the hyper-focused risk assessment and safety planning, how is this so effective? But at the same time, if you see the statistics of crisis lines like 988, even system navigation services like 211 or the distress center, different distress centers. Like if you see who are mostly the callers, are not the ethnoculturally diverse callers or the LGBTQ callers. Like most of the people who call crisis lines tend to be within white groups. So if these approaches are so effective, how come is that ethnoculturally diverse people call crisis lines maybe one time and they will never call, or they call and they are waiting for 40 minutes, and then when they finally receive the call back with the interpreter, etc., they sometimes suspend or end the call early, right? So we try to understand like these models that were supposed to be so effective, with whom they were piloted and tested. And we found that in the case of the Roberts approach that most of us are familiar with, they tested that approach with mostly middle-class white women in the US. So it was not piloted, tested, or with ethnoculturally diverse groups. And in the case of Canada, the assist model has been more effective in the context of, in the Canadian context, but has been proven not to be effective, for example, with indigenous groups. So these models show that one model cannot fit all, right? So in terms of what has been our key learnings is we believe that these approaches need to be critically examined. They need to be revised. With ethnoculturally diverse groups, it could not be the hyper focus on risk assessment and safety planning. Most of other cultures, they first create a relationship and then they maybe go to risk assessment and safety planning. But it's important first to create the relationships. I have seen in trainings, for example, when someone from ethnoculturally diverse groups start doing the practice of doing the risk assessment, how you might not use the word suicide, for example, right? Tell me about those dark ideas. They tend to use the language of the caller, but then sometimes supervisors correct that. They interrupt and say, ask directly. Ask if they have suicidal ideation. Ask if they have suicidal plan. Ask if they have. So most of what we have seen in supervision practices with ethnoculturally diverse is trying to, again, impose the conceptualization of what has been working for white communities versus what really works and is more meaningful and impactful with ethnoculturally diverse. And we see that, like, if you say, like, what has been our learning is that people need to raise awareness, be more educated, improve their learning about cultural attuned practices, culturally attuned, how we can't attune with the client if we belong to different cultures. As Aklam was saying, and members of the team, we need to minimize barriers to access these services. But the barrier sometimes is, okay, language barriers. Let's try to bring more translators. Let's try to bring more people who speak other languages. But sometimes the barriers are not exclusively language barriers. There are other barriers. People calling and also seeing themselves represented in the responders, cultural practices being embedded and embodied in the response. So I think those are some of the main things that we wanted to highlight today.
Thank you so much. Yes, it's very, very important what this research came up with and I think you summarize it at the end with language interpretation service is not the solution. There is something more important behind, which is the culturally response to the needs and assessments. So yes, I'm just waiting how you're gonna interpret this one with training maybe, or tools that all the service providers can use and train, improve the skills. Thank you so much. Jane mentioned in the chat that I have a close friend who works on suicide intervention trainings, not sure which, but it's not ACEST. Could you share a link or materials that I might be able to pass to her? You are muted.
Yeah, thank you, Jane. So we will paste in a moment our website there. And I think we have recently, should be available maybe two of our recent published papers, and we tell more about those pieces. And occasionally we are offering also training in the community. We have offered a couple free of charge. And I'm not sure if we will continue offering free of charge, but it's going to be very accessible. And if we offer in the future, but yes, so we are doing presentation like this one, so you can recommend your friend if we do another free webinar. And we usually update our website and we share there resources, PowerPoint, the link to papers that we have published. So I will encourage Jane to maybe invited your friend to explore more of what we are doing. We should create a YouTube channel like yours, Rafi. I didn't know that the Newcomer Knowledge Hub had a YouTube channel and you are posting these recorded webinars. That never occurred to us. Maybe we should start a YouTube channel and post the recordings there. But maybe, Jane, you can, once Rafi upload this in YouTube, maybe you can share with your friend this recording and the others that the Newcomer Hub are posting.
I personally strongly encourage you to do the YouTube channel to share this very valuable information. And yes, mostly by tomorrow or Thursday, the series will be uploaded and you can enjoy with it again. Any questions, folks? You can add it to the chat. You're welcome. Okay, I'm interested in knowing as well, like very briefly, what the method you use for quantitative and qualitative data, like interviewing if you interview the service providers, clients, like what some methods you did to come with these findings.
Yes, I can start that question. Maybe Tara can tell more. So one of the things that have been difficult for us is doing quantitative research, and mostly because, like with this type of participants is difficult, like they call for because they are in crisis, and then you, after they call, you send a link saying, oh, by the way, we're doing research, can you please answer this question? So it has been tricky, but we found in qualitative research like being a good method, because then they can express themselves, we can raise their voices. So our data comes from participants that are in Alberta and across Canada. And we offer gift cards to our participants. We interview them, and we have been using different methods to analyze the interviews. We have been using thematic analysis, constructivist grounded theory. We are going to also analyze data using discourse analysis this summer. And we have been interviewing experts in ethnocultural theories and practices. We have been interviewing people, experts in suicide prevention and intervention. We have been interviewing the callers, the frontline practitioners, the responders. So we have a sense of, like, most of the interviews do not come only from callers. It comes from what are the challenges that responders have faced? What are the challenges that callers have faced? What are the recommendations from people who focus on racialized newcomers, ethnoculturally diverse groups? What they have learned? What pearls of wisdom they can share with us? and what other methodologies we have used. And one of the most important, and thanks to the leadership of Tara, is we have been using World Cafe. And the World Cafe is a very participatory, qualitative approach and action-oriented, in which you bring together in dialogue community. And in these community dialogues, we bring together organizations, experts, frontline practitioners, callers, family members of the callers. So practically all members of the community are invited to come, be in dialogue, and share wisdom about what has worked, what has not worked, and what should be changed. And maybe Tara, you would like to share more about the methodological approaches.
Yeah, I was also going to say for the pilot project, we use phenomenology as well. Yeah, so we had looked at publishing a paper with, I believe, 5 participants, so just a small little study there as well. We do also have surveys, and so we do offer like the mixed methods survey. However, with that, we have not got a very high response rate, and so that's where kind of our quantitative piece has kind of fallen in the sidelines anyways. Because we offer kind of a prize at the end of it, but the problem is we don't have enough people to even do the prize at this point in time. So it's predominantly the qualitative interviews and the World Cafe that we've been focusing on. So.
Perfect. Thank you so much. Any other questions? So yeah, if you have any questions later, you can share. You can directly use the email of Dr. Monica. All right, so you have 15 extra minutes to relax or continue your lunch. Again and again, thank you so very much for the very informative, very wonderful presentation. It's very important for service providers, for stakeholders, for everyone, even absolutely for the newcomer in the first stage. So thank you so much for all your work, and looking forward maybe after 6 months or next year, you're going to get the next step of this research, and we will have you again to share more. With that, I will wish very wonderful day for everyone, and we'll see you next month, April 28th, and please wait the invitation for the Microsoft Teams meeting instead of the webinar. Okay, thank you everyone, and have a wonderful day.
Thank you very much, Rafi, and all your team in the Knowledge Hub. Thank you.
Thank you.